vaccine policy in New Jersey. And it does it so in a way that moves authority away from the public, moves it away from transparent national standards and into a closed system inside the New Jersey Department of Health, and gives sole authority to the New Jersey Department of Health, which allows the Department of Health to set vaccine requirements on its own or in coordination with public health groups that New Jersey voters cannot see, we can't subpoena them, and we can't hold them accountable. That's not a small technical change. This bill is actually an incredible transfer of power.
The New Jersey Statehouse Watch is on. From Trenton, we explain what's happening inside the State House, speaking directly with legislators, policymakers, and budget experts to bring you the facts behind the decisions.
There's no doubt that energy bills are about to skyrocket this summer.
$300 million to Newark billionaires? That ain't cutting it for rural New Jersey. Enough of it.
Madam Clerk, please on the machine for a vote.
Received 46 votes in the affirmative, 25 in the negative, and 0 abstention.
We break down bills as they move through the New Jersey legislature before they become law. With your hosts, Jack Brangan and Constance Ditzel. So stick around. Here's Jack and Connie.
Well, good evening, everyone.
Good evening.
My name is Jack Brangan. I'm here with Constance Ditzel, and you have arrived at the New Jersey Statehouse Watch. And so it must be either the second or the fourth Tuesday of the month.
That's right.
So you can find us here twice a month. Different topics. We are going to be focusing strictly on New Jersey issues and the New Jersey Statehouse, what's going through the legislature. And we're available live on the second and the fourth Tuesday of every month. In addition to that, the podcast can be downloaded from Apple Podcasts, Spotify, or wherever you get your podcast, and listen to it whenever you have the time. So this evening we're going to be talking about vaccines, and we have a special guest here, Melanie Dragone from New Jersey FIPAC. And the vaccines, many things have changed since we've gotten a new governor. One of the main changes, we are now a sanctuary state. And then another change that has occurred is that the process for determining the vaccine schedule has dramatically changed. And Melanie is an expert on that change, and we'll be diving into that pretty deeply. This is important because this change affects not only you, but your family, your kids, your employment, insurance companies. It's going to affect everybody in the state. So this is not something that should be taken lightly. This is already in place, and it's afoot. It's in action right now. So Melanie is from New Jersey FIPAC. So that acronym is NJ, PHI, PAC. The NJ is for New Jersey. PHI is for PHI is Public Health Innovations, and the PAC is Political Action Group. We're going to be talking about New Jersey and public health tonight. We're not going to deal with the PAC at this point, but we just want to make sure that you understand that we're going to focus on the process here. That we are not an anti-vax group here at New Jersey Statehouse Watch, and NJ FIPAC is not anti-vax. But there have been changes that concerns them and concerns us as well. Before we get into this, Melanie is going to be talking about two major bodies of laws and regulations. And in New Jersey, we all live under multiple tiers of laws and regulations. The highest tier being the New Jersey State Constitution. That is the highest law of the land. It has things like you must be a U.S. citizen to vote. That means that you must be a verified U.S. citizen before you can register to vote, and that is a requirement for voting. It is not a suggestion, it's a requirement. That's in the New Jersey State Constitution. Next, under the Constitution are public laws in New Jersey. This is going to be the first thing that Melanie is going to be talking about. For those of you that haven't been paying attention in Trenton, we have the state assembly, we have the state senate, and then we have the governor. They're the three houses in Trenton. And the public laws will be introduced, for example, into the assembly as a bill. And you're going to hear the bill A6166. And that bill travels through into committees and then to a floor vote. It's amended along the way. If it gets passed in the assembly, a companion bill will go ahead on the Senate side. So there's public bills. And then the final thing that Melanie's going to be talking about is administrative code. Administrative code has to be anchored to a law. And this code is code that is made public at the state legislative digest and must be available for at least 30 days or 60 days for public comment. If there's enough interest, there can be public hearings. And so this is important because it's actually harder to roll back administrative code as it is a law, because to get rid of the administrative code, you have to go through the same process. You have to post it. You have 30 days, 60 days. There's got to be public comment, even to roll it back. So let's start with the law. I think, Constance, you have it.
Sure, I do have the law, and I did want to reiterate who this podcast is for. Don't turn off your screen. If you say, well, I don't have children, I've already been vaccinated, I don't need to hear this. Well, you might be a public employee, you might be a student in higher education, you might be working in the healthcare system, you might just be regularly employed, because I know people who were regularly employed and they were mandated to be vaccinated. So this does affect everybody. Wanted to point that out. So the name of the bill was very simple. Well, they have all these numbers. They change from one legislative season to the next. But essentially revises certain references to the Advisory Committee on Immunization Practices in statutory and regulatory law. That's it. Now, let me tell you that this Advisory Committee on Immunization Practices, that's a tongue twister, is referred to as ACIP, ACIP. So if you hear us slip into that acronym, we're talking about this federal committee that is the Advisory Committee on Immunization Practices that guides the CDC, okay? New Jersey says they're going to revise references to them. And by that, they wanted to strip all references to the federal ACIP, CDC's committee on immunization practice from New Jersey. No more listening to them. They want to transfer final authority for childhood vaccine requirements and all vaccine requirements from the federal to New Jersey Department of Health. Now, why should that concern you? We're going to let you know. I didn't know why that would concern me so much. I did go up on December 8th. I was one of the people that went to the committee hearing to listen. And even though it was about regulation, they were very, very concerned about recent statements about the Hep B vaccine, for example, that RFK Jr. wanted to pull it back from giving it to a baby at 2 hours of birth to 2 months.
Right.
He pulled it back that much, just to 2 months, and there was a big reaction to that. Yeah. And I know that to be a fact because I sat there and listened to that. They kept bringing that up again and again and again. Right. So that had to be some reaction. So I think what we want to do next is Melanie's going to explain that decision, that practice that Jack just described, regulatory code versus law. She's going to do that. But first, we're going to bring her out, and I will introduce Melanie Dragone. And I want her to tell us a little bit about her organization and who she is and how she got involved. Are you here, Melanie?
I am. Thanks so much for having me this evening. Thank you guys so much for having me.
We're glad you're here.
Yeah, I appreciate it.
So tell us a little bit about New Jersey FIPAC and yourself.
Sure. New Jersey Public Health Innovation PAC is a New Jersey political action committee. We were founded in 2021. I'm one of the founders, myself, and 6 other New Jersey parents. We formed following the successful defense of the New Jersey's state religious exemption in 2020. We're dedicated to protecting every resident's fundamental right to make medical decisions for themselves and their families without coercion or undue government constraint. We carefully vet New Jersey legislative as well as federal candidates, and we evaluate their positions on health freedom, parental rights, and informed consent. And they go through a rigorous process. And then, in turn, that information is created our voter guide that helps parents to make informed decisions and choices at the ballot box.
So, okay, so how big is New Jersey Fight Pack? Do you have it's all over the state?
Yes, we cover the entire state. So we look at the races all throughout the state, on the legislative level as well as the federal level.
Okay. Actually, Constance and I ran for assembly in our districts, and we were severely interrogated by NJ Fight Pack. Not really, but...
and I'm proud to say you were both endorsed by our political action committee.
Happily so. And you had a really wonderful gala that we went to. And I was impressed at the number of passionate people, the number of assembly people that came, the number of policymakers that came. This is no joke.
Yeah.
A very, very serious matter for a lot of policymakers. Right. So you guys have come a long way. That's terrific.
Yes, so, 100%. 100%.
Yes.
Just one comment here before you get into the nitty gritty. This change here, now New Jersey has been following the guidelines of the CDC for 60 years. So I know we introduced ACIP, but taken together, basically we're saying that New Jersey is no longer going to follow the guidelines of the CDC. And for 60 years, we have done that. And now magically, with Mikey Sherrill, they have decided this is not a good idea for some reason now. And they're no longer going to do that, which to me is pretty shocking, considering when you think about the CDC has almost 60,000 employees, and many of these doctors are preeminent doctors, experts in their field, writing original paper and doing original research on a lot of these diseases. This is not a group you don't want to put aside or not listen to anymore, I would not think. So this change, frankly, makes me a little nervous. Makes me very nervous.
Let's bring up that first slide, and we can start right away. And that first slide will guide her a little bit, I think.
Yeah.
In the code.
Yeah, so this bill, to your point, Jack, wasn't just about vaccines. It was about who gets to decide vaccine policy here in New Jersey. It moved everything further away from the elected lawmakers and closer to the New Jersey Department of Health specifically. And they are an appointed agency. And they're the sole decision makers as per this new bill. And it actually wasn't Mikey's bill, it was Murphy's bill. So it all transpired before she came into office.
That's right.
Right. And this slide, it outlines what the new law represents. This law shifts vaccine policy, as you said, the authority from the New Jersey Department of Health, meaning that any future decisions regarding vaccine requirements, they're going to be made at the administrative agency level rather than primarily through a legislative process. It literally centralizes decision-making from within this appointed agency and increases reliance on recommendations from professional medical organizations instead of the CDC's ACIP, the Advisory Committee on Immunization Practices. And this really creates a framework where future vaccine requirements here in the state could be expanded through regulatory action, and our voices will not be heard at all.
Right.
Wow.
So is there opportunity for input by the public? Is there recourse? Or are we just left out of the picture completely?
Yeah, right now, because this bill already passed and was signed into law before Murphy left office, there's really not much recourse that we have at this point. Many of us, as Constance alluded to, went to Trenton and testified against this bill. We had a call to action that we put out as an organization that encouraged people to call and to write emails to the health committees, encouraging them not to pass this bill. But it all fell on deaf ears, unfortunately.
Let's bring up the next slide then,
Sure.
because I think that's a real good graphic showing how things have been until now.
Yes, so this slide shows how immunization policy traditionally functioned in New Jersey prior to this becoming law. At the top, you'll see federal guidance from the Centers for Disease Control and ACIP, the Advisory Committee on Immunization Practices, and they would provide national recommendations through a process, right? There was public meetings, there would be public comment periods, there were recorded votes by the members of that committee, and there was also conflict of interest disclosures that had to be signed and indicated to the public for this to work. The state of New Jersey then would decide which of these recommendations that they would adopt here in the state, and they would establish mandates through their own regulatory process. And finally, the enforcement would happen on the local level through schools and higher education institutions. So in essence, this policy flowed from federal guidance to state consideration and adoption, and then to local enforcement. And that was all prior to this year.
So let's show the next slide and see where we are now.
So this slide, yeah. Now, this slide illustrates how the immunization policy process looks. Rather than beginning with the federal CDC guidance, policy formation now relies more heavily on recommendations from those third-party medical organizations like the American Academy of Pediatrics, American Medical Association, all of those organizations with well-documented conflicts of interest and bias, right? And then the New Jersey Department of Health, with guidance from these organizations, will set statewide immunization policy. And then the local institutions will continue to enforce the mandates on a local level.
So if I just, for our listeners, if you can't read that top one in white, the top of the big part of the triangle, the inverted triangle, these are big organizations: American Academy of Pediatrics, American Medical Association, American College of Obstetrics and Gynecology, Advisory Committee on Immunization Practices, Northeast Public Health Collaborative. These are all very big. And in addition, they're stepping outside to a Northeast Public Health Collaborative. What do you think that's about, Jack? That's not even, that's stepping outside of state a little bit, but not going to federal. It's going to a collaborative.
Right. I think that's a group of 5 states, that loosely defined organization. The thing that bothers me about these professional organizations, just so people have the right framework, just about all of these organizations supported affirmative transgender care for minors. Mm-hmm. So I know for sure the American Academy of Pediatrics did. I'm pretty sure the rest of them did. So these are organizations that affirmatively supported any confused minor teenager, and also affirmed, using the drug therapy and sex hormones and that sort of thing. So again, this is a little disturbing here, that these organizations now are going to have primary input into the Department of Health here. So
there's a legitimate question about their knowledge. I mean, we're not saying that they don't have a knowledge base. We'd probably like it to hear it, but it seems rather imbalanced, because these are the same people that are prescribing the drugs and the vaccines and are earning enormous amounts of money, particularly in the world of gender care. So there does seem to be a conflict.
I also want to make a comment about this bill 6166. People should be aware that this bill, it was in the last legislative session. This bill was passed on January 12th. Now, the thing that's important about that day, that was what they call a lame duck session. It was the final legislative session of 2025. In that session, the Assembly heard 150 bills.
Yeah.
One of the bills was this A6166. So it went for 7 hours. I did listen to all 7 hours of that session. When this bill came up, I would say there's probably 10 minutes of discussion about it, which was primarily all of the Republican fighters in the Assembly arguing against this. The Democrat side didn't even defend it.
And
No one stood up to say anything.
Totally Democrat-sponsored bill. I wanted to mention the three names that sponsored it. It's worth knowing. Were Andrew Zwicker, Carol Murphy, and Joseph Fatale. So three.
So on that day, 150 bills, this was one of them. On that day also, 120 of those bills, to your point, were Democrat only. So we really need to think about if this is the best for New Jersey, if this is the well-oiled machine. We like to think there was vigorous debate over 6166, but it just did not happen.
Let's bring up that next slide, Damon. Mr. Producer.
Mr. Producer.
Mr. Producer.
So this slide talks about the New Jersey Department of Health code changes that took place that were solidified in December of 2025. And these were not just routine technical updates of their code. They significantly expanded the authority, again, of the New Jersey Department of Health to regulate immunization policy and manage vaccine registry data. The amendments in these codes strengthened the New Jersey Immunization Information System and broadened how immunization records are collected, stored, and utilized across New Jersey. The concern is that when policy is embedded into administrative code, it becomes far more difficult to reverse than legislation, which is what Jack alluded to earlier. So we're really concerned about these new code changes. They brought this to our attention in August of 2025. And as you mentioned, Jack, there was a 60-day comment period, which we encourage New Jersey residents to make public comments. There were over 2,600 public comments. There was also requests for a public hearing on these code changes, and we were completely ignored. They didn't make any changes to the codes that they suggested in August, and what they passed in December looked identical.
Wow. And what I also didn't realize, actually I have two questions for you, but on your point, there's a lawsuit now, correct?
Yes. So we have joined together with other health policy organizations, and Dana Weafer and John Coyle are challenging the procedural process used to adopt these codes. The lawsuit isn't about opposing vaccines or anything about public health. It's about the process, right? The governance, the accountability that took place. Our questions are about how administrative agencies can effectively establish binding health policy without any direct legislative action, because the people we elected now have no input. And we want to know what safeguards exist when the guidance just evolves and this policy is just enforced.
Wow, we'll be curious to see how that lawsuit proceeds.
Yes.
You've also enlightened me too. I did not realize that we've got a database since 2004 for the vaccines. Now, this pertains apparently to our children, but we too, who I don't think are children anymore, as soon as we get a vaccine, we're now in this database. And describe this, what it means, the difference between opting in and opting out of this database.
You got it. So the New Jersey Immunization Information System, NJIIS, is a vaccine registry, a tracking system, basically, that is looking at all the vaccines that your child receives. Your child is automatically enrolled upon issuance of a birth certificate here in New Jersey. And if your child wasn't born in New Jersey, then they will be put on the registry the first time that they receive a vaccine in the state of New Jersey. And to your point, Constance, now with these code changes, adults have been added. So the first vaccine that you receive, you will automatically be enrolled onto this registry as an adult. And the only way to get off of this registry is to opt out. So you're not giving any consent for your child or for yourself to be on this registry. And in essence, they're, following your medical information from cradle to grave.
So nobody knows this. I mean, when I say nobody knows this, there are a select few. Your group knows this. We know this now. But that means a 35-year-old mom takes her children to a pediatric doctor tomorrow. Mm-hmm. They get a vaccine. They don't realize that they're now already in a registry and that they're there. I mean, they can opt out, but they have to make the fuss about it.
Yes. There's a withdrawal form that you can fill out and send into the Department of Health and have your child or yourself removed from the registry. But to your point, most parents are unaware that this transaction is even happening.
Right. So we hear the phrase informed consent all the time. Mm-hmm. This is a case where if parents are not aware, they cannot give their consent. And,
I mean, I'm trying to think because I'd like to be a devil's advocate too. I mean, what's the harm of them being in this database? I'm thinking about my kids. I mean, it's kind of personal information. I don't want this all over the world, I guess. But what's the harm in essence?
So the concern is really about the confidentiality of this confidential medical information that unfortunately New Jersey views as just like passive information. So the school nurse has access to it. So if your school nurse is also a mom in your town, like let's hope that she keeps medical confidentiality. If your best friend's sister is the medical manager at the local medical office that you go to, she too has access to that information. So it's really concerning about who has access to this NJIIS. And not only that, but there's also been a report to me personally that someone has been denied access to a New Jersey hospital utilizing their ID, their real ID. And they were not permitted to enter the hospital to visit a family member because it said that they didn't have a COVID vaccine.
Oh my gosh, we're off to the races.
In 2026. I'm not even saying this was like 4 or 5 years ago. This is a new occurrence. So I think personally that the registry will then be linked to your real ID and then the national registry. So eventually everyone's medical status can be tracked, just like they wanted during COVID.
And this is what the World Economic Forum would like too. So when you're traveling.
So it could be linked to your employment. And back in the COVID days, if you did not get the shot, they run that scan on the database, and these are the people up to be terminated, from...
Right.
Yeah, wow. It's a slippery slope.
If you get a new job, right, and you're applying for new insurance through your new employer, and then they look at the registry and you haven't received the vaccines that they consider necessary, perhaps you would be discriminated against. I mean, it's a really slippery slope, for sure.
Throw up the next slide, Mr. Producer, because this pertains to that. What do we have? Now look at those names.
Yes.
What is special about these names? These are some of the people that are on the advisory panel?
Well, the important name up there is in the upper left-hand corner, and that's the American Academy of Pediatrics. Now, I already mentioned, this is an organization that's going to have major input into the New Jersey Department of Health. I've already mentioned that they support, the medication of transgender minors. What this slide shows are what we'll call partners. These are all drug companies that are involved with the American Academy of Pediatrics. And if you look at the top, the President's Circle, these are drug companies that have contributed $50,000 or more to the American Academy of Pediatrics. So, this is not the cleanest operation here. There's money, big money flowing all around these organizations. This is only one. And we just saw a list of a dozen other organizations.
It strikes me, and I mentioned this in my testimony, in New Jersey alone, we have some very large drug companies. We have J&J, Johnson & Johnson, who, by the way, is pulling out because the corporate taxes are so high. And we have Merck. These are big companies. you got to wonder if they've got some lobbying advantage here too.
Yeah.
It's just a little too close for comfort.
Right. So if these drug companies have a vaccine that could possibly go on the schedule for infants, they would have influence on the American Academy of Pediatrics, and that's the danger here.
Mm-hmm. So. Now, this, of course, is not a political matter. So that's why, Mr. Producer, show us the next slide. This is not a political matter at all. That's going to be hard to read. Melanie, can you pull some of the finer points out of there?
Sure. So Governor Murphy put out this tweet after he signed this new bill into law. And as you can all see, he makes it very clear that he passing this law politically, for political reasons. It says, we've seen RFK Jr. and the Trump administration do everything in their power to undermine trust in vaccines and health professionals. Today, I signed legislation ensuring vaccination and immunization, which are the same things. Guidance is state-based. So this was clear in a tweet from our governor at the time that they were introducing this bill, passing this law in defiance of what was happening in DC.
Right. And that's the worst part about this.
Right. It's like, what is more important, your politics or the status of your citizenry?
This is Trump disorder syndrome bill, is really what it is.
You know, that is, I don't know what else to say about that. But of course, Mikey Sherrill wasn't part of this, but she seems to be joining the same game. It concerns me too that New Jersey is going to become a little bit more provincial. We're making ourselves more provincial. We want to be autonomous. We want to be out on our own. And what bothers me is that the inverted cone you showed, Melanie, it started out a triangle, now is inverted. We're scaling back our input from the rest of the world. First of all, from our own Fed, from our own
health agencies.
Thank you. And then in addition, are they paying attention to research and studies around the world? The UK will not allow vaccines, at least the COVID-19 vaccine, for people under 18. Yeah. Denmark will not allow it for people under 18. Sweden, under 30 years old, they're not recommending it. Switzerland is defining lower risk populations. Australia, not under 18. And yet, big and bold on our site, it still has recommended for a child 6 months and older.
That's unbelievable.
That they're they're not in that comorbidity group.
Right.
So here we are. We're going to go off on our own bandwagon. And you know, I just was giggling almost from the past. I read to my kids a long time ago. It was a book called Bert and Ernie's Different Day. Bert and Ernie from Sesame Street. And Bert and Ernie spent a day. They said, let's do everything different today. Let's do the opposite of what's going on. So New Jersey is having a different day every day, it seems. They just want to do it differently. And you know what else bugs me? I didn't hear any mention of dollars. You think building up this Department of Health isn't going to mean new staff positions, more money? And if they're serious about paying attention to this kind of data, if they're serious about other things we're going to bring up after the break, actually, this is going to take a little bit of mucho changeo.
Yeah.
Yeah. And not only that, but there's no process in place. So there's no public hearings. There's no, hearing from the public at all. The Department of Health get to dictate vaccine policy in a way that even the CDC had a process in place. And so that's really the most alarming part. Is that there is no process in place. They're going to pivot to these organizations and just take their guidance and put it into practice here in New Jersey.
Yeah. So, go ahead.
Go ahead. I was just going to, we thought we'd take a little break and we can talk more about this. Great. But it might be good to take a drink of water.
America's Pulse Network. The mainstream media is bought and paid for. The truth is twisted to fit their agenda, but America is waking up. Because podcasts are the future for trusted media, welcome to the America's Pulse Network. It is a network built by patriots that upholds the Constitution. But America's Pulse Network stands for God, truth, and the America First movement. There is no corporate propaganda, no government spin, just real news, real talk, and real voices fighting for faith, freedom, and the future of this great nation with common sense. Here are some of America's Pulse Network podcasts. Alexandra Levine Live, hosted by Alexandra Levine. Jersey Shore Podcast, hosted by Damon Galdo. The Conservative Corner, hosted by Seth Eisenberg. The New Jersey Statehouse Watch, hosted by Jack Brangan and Constance Ditzel. APN's The Pulse is moderated by either Alexandra, Damon, Elena, or Seth. Also tune into America's Pulse Network on the following social media platforms. Join the revolution because the pulse of America beats for God and country. America's Pulse Network is for faith, family, freedom, and truth.
Then looks like we're back.
Looks like we're back. I think we have a clip we were going to show.
Doctors group form united front against RFK Jr.'s effort to limit vaccine access. Listen, he is not trying to limit anything. He's trying to allow informed consent. But 6 leading health organizations made these claims. The American Academy of Pediatrics signed on to this. Yes, they still recommend that you get a COVID shot if you're 6 months of age. The Infectious Disease Society of America, the American College of OBGYN, they think all newborns should get a hepatitis B vaccine and receive vitamin K. The American College of Physicians. These organizations now must be viewed through the lens that they deserve. They are a left-leaning political organization, not a healthcare organization. They care about the bottom line. Yep, pharma dollars, not about the health of the American.
So that's a little startling, I think. That's a little startling. And the reason we're bringing this up again, because I was in that committee hearing, they spent several minutes talking about the Hep B vaccine. And I just want to make a comment here that the CDC says that they are now recommending, they're saying these vaccines contain 250 micrograms of aluminum. And the CDC recommended upper limit for newborns is 18 milligrams, micrograms. So 18 micrograms versus 250.
Yeah.
Now, the CDC, now they're not perfect either. They've made, mistakes in the past, but they're coming around, and that's startling. Why do you want to give a 2-hour-old baby that much?
It's way over the limit. Yeah. Right.
And this raised the question when they started digging into vaccines. Is it the vaccine that's causing problems with some of these children? Or is it the adjuvants, the aluminums that are carrying them through? That is a really strong statement there.
Right. Yeah. So in the comment there by Phil Murphy at the bottom, it referred to the insurance companies.
Oh, yeah.
That the insurance companies will have to follow whatever the recommendations now of the Department of Health. So, first of all, whatever the premium, don't forget, we will always be paying the, whatever the increase in cost is, we're going to be paying that in premiums. The insurance companies are told to cover things all the time. So this is a pretty regular occurrence. There are limitations. If the company fails to make a profit, they can make a decision about whether they want to remain selling a particular line of insurance in the state. So, for example, for the medical insurance, they will have to pick up any costs here. They can't refuse an individual thing, but they can decide well, maybe New Jersey, we're not making enough money or we're not making any money selling medical insurance, they can pull out of the state, but they would have to pull out by an entire line of business, not by, an individual part of that business. So it's not just people, but there's, the insurance companies are impacted, and, no matter what the impact is, it's going to bounce back to us in premiums, and they're already, sky high now for medical insurance.
Do you know anything else about that, Melanie, the aspect of insurance? Or
Just that, to your point, that the bill that was passed did say that whatever New Jersey puts on the list, their mandated list, that the insurance companies would have to comply with.
Right.
And so that was a big part of it. And I think it's important to clarify that, in regards to Hep B, that Robert F. Kennedy Jr. and CDC's ACIP, the Advisory Committee on Immunization Practices, they were just asking for, to your point, instead of on first day of life, to receive this vaccine that really was created for IV drug users and prostitutes, basically, that you can push it off and wait until your 2 month appointment with your personal pediatrician, not in the hospital, and make an informed decision. It wasn't eliminating access to the vaccine. It was just empowering families to have conversations with their personal health practitioner and decide whether or not they want to inject their child with that vaccine and have true informed consent.
that seems so reasonable to back it up from that very tiny hours old age, to back it up just a little bit. And that's why it's worth noting, if you jump into this podcast late, RFK Jr. pulled back from 18 to 11 childhood vaccines. That came out just early this year. That's his recommendation. So in other words, he's clearly not anti-vax, and he'll say so anytime. He's anti-unresearched vaccinations. And it's troubling that many of these vaccines are researched and tested on rats and lab animals, but not babies or humans. So his beef is how much research is going behind it. I won't speak for him, but all I'm saying is that if he backed off from 18 to 11, he's not anti-vax.
Right.
He's up for making your choices. These we feel good about.
Right. And they're not undermining, the vaccines with the health professionals. This is a complete overstatement here by Phil Murphy. Melanie, with the legislature in the old way, what role did the legislature have with the vaccines? Would they approve the vaccine schedule? Would they? What role did they have, if any, in the old way? I mean, we know now, since they voted 61-66 in, they basically voted themselves out of the picture. Right. But, what did they do beforehand? Do you know?
Yes, there were several bills over the years that I've been doing advocacy that introduced, say, the HPV vaccine that they wanted to require for school attendance. And it would be a bill just like the bills that we see, and there would be sponsors, and it would be heard in committee. It would be the same process as well. So the introduction of a new vaccine to the mandated list for school would be a legislative process prior to to 2026 and the code changes.
Right. And that process was under a bright light. It was available to the public to listen to all of the testimony and all the committees, and also provide input. And all that now is gone, right? Because it doesn't sound like the legislature has a role anymore.
Right. They handed all the power to the Department of Health.
So far, we think, and I'll let you expand on this, we still think we have religious exemptions, medical exemptions, and Hawley's Law. Tell us about all three of those things.
So medical exemptions are available in New Jersey. They are very difficult to get. They are on a vaccine by vaccine basis. So you would have had to have had already an adverse event like anaphylaxis from that vaccine in order to qualify for a medical exemption. And it would only be for that vaccine. And annually, you have to re-up it with your healthcare professional. And what we found is that when healthcare professionals do issue medical exemptions, sometimes they are penalized in various ways. So it does exist. It is a hard path for many families. Even if your sibling had an adverse effect from a vaccine, you may not qualify for a medical exemption. The religious exemption is also still available, and that is if the vaccines are against your personal religion. You would write a letter to your institution in lieu of a vaccine, like your vaccine list, and you submit it with your school records. And that too still exists. And Holly's Law, thank you for bringing that up. It's very near and dear to my heart. The Stavola family unfortunately lost their 5-year-old daughter, Holly Stavola, in the late 90s after she received her second MMR vaccine, measles, mumps, rubella. After she received that vaccine, she died here in New Jersey, and her parents lobbied after her death to have Holly's Law passed. And Holly's Law allows for New Jersey parents to have a blood test taken on their child, a titer test, they call it. And that test would indicate whether or not they had full immunity from their first MMR vaccine. So that would avoid them having to receive the second MMR vaccine, because majority of children receive the first vaccine and they have full immunity from that, but they offer the second vaccine, and Holly's Law allows for that blood test in lieu of the second vaccine because of what happened to Holly. Her parents were compensated by the government, and it was acknowledged that the MMR vaccine killed Holly. And so we thank the Stavola family always for their advocacy many years ago, and acknowledge that many of the sitting legislators were sitting then and acknowledged that there's a risk involved in vaccination, and they supported Holly's Law. It was both sides of the aisle supported it. And so, we're thankful for them, for their advocacy, and we always remember Holly.
Again, something a lot of people don't know.
Sure.
Something so many parents, now revisiting all this, I'm going to let a lot of young mothers know.
100%. And that's really what, the work that I do here in New Jersey is to educate and empower parents to make informed medical decisions on behalf of their families. And knowing things like their right to Holly's Law, right? And not giving the second MMR vaccine, or their right to a medical exemption or a religious exemption is really vital. Because understanding your own family's history, maybe a vaccine reaction that a cousin or an uncle had, that if you have the same DNA may happen to your child as well. So we just need parents to understand, what they're entitled to here in New Jersey, and to also understand that there are practitioners who will work with them on an individual basis, because in 2026, a one-size-fits-all medical interventions is just so antiquated.
Right. So another big miss is the VAERS system. That VAERS stands for the Vaccine Adverse Event Reporting System, that is run by the CDC. This basically gives the CDC headlights into the darkness of how successful their vaccines are. So this system will record adverse events across the country for any individual that was vaccine injured, and keep a running tally so that they'll be able to develop a profile and, if necessary, roll a vaccine back if it's causing more injury than is tolerable, let's put it that way. New Jersey doesn't have that. So they're going to be sort of blind, as if they make a change, they will have no good way to accumulate all the data to get a good view of what's going on in the state. They may get reports from a county here and there, but it's nothing like the VAERS system. The other thing that this system did, I believe, would allow those that are vaccine injured to be compensated by the U.S. government, for the injury that's caused by the vaccine. That's not going to take place in New Jersey.
Well, do we know, Melanie, anything? Have you heard wind of any VAERS-like program?
There won't be a New Jersey-based system. However, families can still report to the CDC's vaccine adverse event reporting system. It's kind of sticky because it's a self-reporting system. Either you report as the parent or your doctor can report on it. And unfortunately, a lot of doctors are not aware that that system exists, and they kind of downplay some of the adverse events that may occur, here in New Jersey and across the country. And it's a self-reporting system. So it's not as successful as it could be if people were actively, sharing information and putting information in there. It's the only way for post-market, the vaccine company to see what's happening post-market, but it's underutilized is what I'll say.
And I've also heard that it's kind of clunky. It takes maybe 45 minutes to fill out one of these reports too. It's not
user-friendly, not user-friendly.
No, it's not user-friendly. You have to go to an effort. And during COVID, the European reporting system was far better, and they were keeping better track of people who were losing their lives after taking a shot.
And I believe that that's all by design, unfortunately.
Well, yes, there's that too.
Not easy to report those adverse events.
There's real reason to be informed, to know. I mean, just to give some other examples, there was a thorough study done. They had to get a court order for Pfizer to release their documents, their research. They had a 75-year pause that they were going to release documents. And some court was able to get that unlocked. Mm-hmm. And they started digging into the Pfizer documents. And one of the things they found was on the thing of women. 270 women were pregnant during the Pfizer study. 234 of these records vanished. Now, that is just unconscionable. You don't lose things in a study. They vanished. With 35 remaining, 80% lost their babies.
Wow. That's
a big number. So we don't know about the rest of them. But unfortunately, the hospitals have stated the number of miscarriages, stillbirths has gone way up. Babies born alive are having abnormal problems, cardiac. Prior to 2021, these things did not happen like they do now. So it's very hard to make a direct correlation. But to Natalie Wolf's credit, who has done a lot of research, she's the author of this book. She dug through those Pfizer documents meticulously. Right. I met her at her book launch, and I was very impressed to the degree she wanted to get to the bottom of it. So I would say, this is my personal opinion, that a pregnant woman should not take vaccines. And this was advertised as being safe and effective with no real knowledge that it was safe and effective. Yeah. And it certainly wasn't preventing transmission.
Right. It's
and that was admitted by Janine Law at a European Parliament.
Yeah, it's like the whooping cough vaccine.
Oh, tell that one.
That actually my wife and I both got based on an advertisement. At that time, we were watching our grandkids all day. So we would have them all day. And of course, the commercial came on with this awful looking wolf looking down at an infant. Mm-hmm. And, scared us to death. So we ran out and got this whooping cough vaccine, just within days. And now there's a lawsuit against for false advertising, that I don't know, maybe it's not effective. Maybe it was much ado about nothing. I don't know. But I really feel tricked, quite frankly.
So I will mention just two other quick examples because we're starting to go down on time here. My running mate, when I ran for assembly, her daughter took the HPV vaccine. That Gardasil is not a safe adjuvant, is not a safe product, and she almost lost her. There have been cases against this vaccine. It's now recommended for down to 9 years old. There's a case where a woman described meticulously she lost her daughter. She did get a payout after 6 years, but it had to go through all kinds of rigmarole. And yet this is now recommended for children on down to 9. This needs to be vastly studied, this HPV. It needs to be looked at. And as some people know who's listening, since 1986, pharmaceutical companies have got immunity. From they have no liability since 1986. So,
but only for the vaccines that are on the childhood schedule. So, through the ACIP, as soon as that vaccine is put onto the recommended schedule, that's when the shielding from liability occurs. So it's a cash cow for any vaccine manufacturer. As soon as it gets through that process and is recommended, as the first pyramid showed, recommended, and then the states decide whether or not they mandate, and that's that's another piece of information a lot of parents are not aware of, that the pharmaceutical companies are shielded from liability. You are not allowed to sue them directly, or the physician who administered the vaccine is also shielded from liability.
What a deal.
What a deal. Yeah. And then just the last one, remdesivir. This was brought out in lieu of other drugs like ivermectin, hydroxychloroquine. That remdesivir, they did a trial they stopped it back in 2019 because 50% of the those in the study died. It's not a safe drug, and yet they pulled this out. It costs a lot of money too. It's not a cheap drug. They pulled this out during COVID, and we're giving remdesivir. You were taking your life in your hands if you were recommended remdesivir. But that is an accurate stat. Apparently 50% died in the study, so it was discontinued. But yet 20% of patients in the hospital, their bill was discounted if they used remdesivir instead of other medicines like ivermectin. So we are, it's again all about your choice. You may choose, you may not choose, know what you're doing. And I think we have to take another break soon here. And I wanted to acknowledge and thank Melanie.
Thank you guys for having me. This was great. It was so nice chatting with you.
So one ray of hope. Do you know the status of the lawsuit?
The lawsuit is ongoing. The New Jersey litigious process is very interesting.
Very slow.
Yeah, very slow. I just spoke to one of the lawyers this weekend, and it's a process. But we will we'll be having a webinar soon to update the community, to let them know, what the status of the lawsuit is.
Okay.
We'll have you back on when that passes through.
When that starts moving, I'll definitely let you guys know for sure.
Thank you.
Thank you, Melanie, for your time.
We'll take another break.
Okay.
America's Pulse Network. The mainstream media is bought and paid for. The truth is twisted to fit their agenda. But America is waking up. Because podcasts are the future for trusted media. Welcome to the America's Pulse Network. It is a network built by patriots that upholds the Constitution. But America's Pulse Network stands for God, truth, and the America First movement. There is no corporate propaganda, no government spin, just real news, real talk, and real voices fighting for faith, freedom, and the future of this great nation with common sense. Here are some of America's Pulse Network podcasts. Alexandra Levine Live, hosted by Alexandra Levine. Jersey Shore Podcast, hosted by Damon Galdo. The Conservative Corner, hosted by Seth Eisenberg. The New Jersey Statehouse Watch, hosted by Jack Brangan and Constance Ditzel. APN's The Pulse is moderated by either Alexandra, Damon, Elena, or Seth. Also tune into America's Pulse Network on the following social media platforms. Join the revolution, because the pulse of America beats for God and country. America's Pulse Network is for faith, family, freedom, and truth.
Hi, we're back very briefly. We want to remind... I'll let you jump in with that, but I'll turn her back and then I'll give you our web address.
I'll take it.
Where's that? Hi, we're back. We're going to be signing off very shortly. Want to remind you where you can find our download at America's Pulse Network. You can find NewJerseyStatehouse.com for past recordings. We've had Paul Knitra. We had Sean Highland. And tonight we had Melanie Dragone. And who are we coming next? Who's coming next week?
Okay, in 2 weeks, on April 28th, we have Dawn Fantasia. Dawn is, one of the premier fighters in the Assembly. She is in Legislative District number 24, which is up in Sussex County and Warren County. Those counties are the home of what I think is one of the most beautiful spots in the state of New Jersey.
Wow.
You know what's up there?
Oh, no.
The Delaware Water Gap.
Oh, okay.
I don't know if you've ever been up there, but it's quite beautiful.
And Dawn's a fighter. In fact, she was in the clip that we opened the show with, if you noticed. That was Dawn Fantasia.
That's right. May 26th, we have Brian Brangan. That he is in Legislative District 26. Chris Russell will be June 9th. Chris is a political strategist and worked as a sort of consulting with the Jack Ciattarelli campaign, and maybe we'll find out what happened.
And others. And then Audrey Lane, let's not forget, if you've ever heard of Garden State Initiative, really great organization that's looking at your dollars and where they're going in our state budget. So we try to jump topics around. We're going to talk about the budget. We're going to be talking about affordable housing, perhaps.
Yeah.
But the point is, all of these are current topics in your state house. Things that are affecting you and what's going on in your lives, your day-to-day lives.
So
all the time, whether it's money or policy.
So join us in 2 weeks, April 28th, for Dawn Fantasia. And we want to thank everybody for tuning in. If you can't make it, if you didn't catch it tonight, have your friends or have someone download it for you from Apple or Amazon or Spotify.
And we're on all the social media. New Jersey Statehouse Watch.
Yep.
Thank you.
Thank you. Good night.
Thanks for joining us on the New Jersey Statehouse Watch. Join Jack Brangan and Constance Ditzel every second and fourth Tuesday of the month at 7:30 p.m. Watch the show live at njstatehousewatch.com or listen anytime. Download the podcast on Apple, Spotify, Amazon Music, or wherever you get your podcasts. We'll see you next time on the New Jersey Statehouse Watch.